Well, we'll give it over to Xana.
All right, so I looked at emergency medical services during the initial stages of the zombie apocalypse. So here we're only looking at the first 3 to 7 days, really, in the initial stages when we're still figuring out what's going on. Perhaps there's not a clear definition of what zombie is. People are still, having psych assessments going on. We're not sure if zombies are real. So zombies are actually really applicable to what's going on right now. There's a lot of violence in the field. Recently there have been the shootings of police officers in Dallas and Baton Rouge. As well, there's a lot of violence that paramedics are dealing with on a day-to-day basis. There's a lot of drugs right now, which are causing people to behave violently. Mental health is a huge issue right now, and sometimes people are behaving violently. As well, epidemiology with the Ebola crisis recently and with Zika virus, we need to look at a catastrophic event occurring and how we can deal with that. We need to look at how to manage the resources, how we can prepare for these disasters at any time. So I've identified 4 areas that I'm going to go through to make sure that we're ready with the emergency medical services. So the first is scene safety, and this is really important because we need to keep our providers safe, our paramedics, our police officers, and our firefighters, so that they can continue to work. When people get hurt, they're not going to be available, there's going to be less resources. We need to have continue the efforts that are already in place, the triage that happens through 911 dispatch, tiered responses, determining what's safe and what's not. So some key strategies for enhancing our scene safety. We can pair response perhaps as the apocalypse continues, employing the Canadian forces to go out so that we've got armed personnel, we've got Hummer vehicles, equipment. So if we can employ stab vests, bite-resistant gloves and sleeves to protect us a little bit more. There's always the possibility of arming emergency medical personnel, which is a bit of an interesting issue to look at because there's always the risk of the wrong person getting shot. These aren't people who have long amounts of training with firearms, but if there is an apocalypse and it's more important that you stay alive, firearms are important. And then with triage, adding in extra questions, making sure that we know if the scene is safe or not. Maybe employing smartphones, take photos, send things in, trying to get an idea if there are zombies around. So disease transmission and infection control ties into 2 ideas together. Disease transmission is how we're going to get sick. So whether that's the zombie bite or coming into contact with zombie bodily fluids in our blood. And then infection control is how we avoid getting sick, how we're going to stop that from happening. So with this, equipment cleaning and disposal, right now we're going to try and reuse as much of our equipment as possible. Equipment is expensive, cleaning it is great. Depending on how the zombie virus actually is transmitted, once we've got some labs established, we can figure that out. We may need to dispose of a lot more equipment than we were disposing of before. Cleaning our equipment with hot water or heat, bleach, hydrogen peroxide. These things may not be effective depending on the actual mechanism of the zombie virus. With infection control and disease transmission, there's a huge crossover with epidemiology that we're going to need to look at to see where is the zombies, where are they coming from, how is this spreading, is there genetic susceptibilities, should we be screening people, at what stage, especially in the initial stages of the outbreak, we need to determine how people are becoming zombified and how we can isolate them. So whether it's if they're getting bitten and there's an incubation period, or if people who die of natural causes can be turned. Personal protective equipment, this ties in again with scene safety, so bite-resistant gloves and sleeves, increasing the material that we're using with our gloves, wearing bite-resistant gloves and then wearing regular medical gloves over top. And then with location, it's really important to segregate the zombies from the healthy people, so segregating our hospitals, our emergency rooms, making sure that resources that are out there aren't going to be overrun by zombies or people who have been infected and are still in the incubation phases. The last section is the continued response to non-zombie related emergencies, because life goes on. Even though the zombie apocalypse is still going on, people still have heart attacks. Injuries may increase as people are running from zombies and, hurrying up the stairs. They're going to fall down, break their legs. people still have heart attacks, they still have strokes. People with chronic medical conditions still have chronic medical conditions with reduced availability to pharmacies. They may have less medication. And now we need to fear the dead because we don't know if our dead are safe. If a person dies, there's this huge fear that they may become a zombie, especially in these first few days when we're not sure how the dead are rising again and what we can do about it. And that one. Okay, so to continue this, we're going to need to increase the amount of resources we have. One of the issues they found with Ebola was there was a huge lack of the supplies that they needed. They were rewashing gloves and gowns because they didn't have enough equipment. Obviously, if we're starting to have to dispose of equipment we weren't disposing of before, we're going to need more equipment. We're going to need to make sure that everything is safe. As well, especially as frontline providers are taken out of commission, our nurses, doctors, paramedics, police officers, and firefighters, as they're, if they become exposed to the zombie virus, we're going to want to get them out of there so they're not spreading it. So we can grab students, we can grab nursing students, paramedic students, medical students from the Schulich branch here in Windsor, lifeguards, community members with CPR and first aid training, because as the availability of our trained professionals goes down, it's going to kind of become whoever's left is going to have to step up. Also veterinarians. So then designated zombie centers, in Windsor-Essex County, it's really great because we've got Leamington Hospital. It's far away from the city. So depending on, what kind of zombie outbreak we're looking at, we can possibly, try to isolate our zombies in the city and retreat to Leamington. There's a hospital there, kind of like naturally segregating that by location, making sure that until we decide what we're going to do with our infected, we're not placing ourselves at risk by being exposed to them. Then as well with triage here, so using a ZIS, a zombie illness screening, so asking someone, have you been bitten by anything in the last 7 days? Have you been groaning recently? Are you hungry for human flesh? Do you want to bite someone? It's just kind of getting an idea as to see what's going on. Is this person concerned that they're having a heart attack, or are they becoming a zombie and they still want help because they're terrified? We don't want to put anyone at risk. So basically all of our patients are dangerous and we need to be really careful moving into the zombie issue. The stakes are higher now. If you're getting infected, you're going to be spreading that more and more to your coworkers and to future patients.
Sure. Thank you very much, Zana. I love that line, have you been groaning recently?